second forum of 4 this election year. This forum is for the candidates for the St. John's Hospital. We have present Shannon Brennan. You can't hear me? Is that better?
There you go.
Okay. Shannon Brennan, Jim Hunt, Evan Jones, and Bruce Hayes. Not present, and we will get to this, but Matt DeBoer will have a written statement. Mark DeBoer? Well, you know, I've already made a mistake. His statement will be read, and Bill Hoagland has done the video. The sponsors of tonight's event are the League of Women Voters, of course, who we really appreciate doing all this, and the Teton County Library, who we also appreciate. Thank you, Leah, so much. She's been a stalwart over the years for this. We also have the Jackson Hole News and Guide and Buck Rail with us tonight. Also mentioned the funding comes from the Teton Library Foundation and Friends and the Community Foundation of Jackson Hole. We're getting video done by Sam Pope. Is there a translator tonight?
There is, but there's no need.
Okay. This will be translated, and the video will be available for you to look at later and tell your friends who were not able to make it tonight. So, here are the rules of the forum for the 4 of you are here. There will be questions coming from alternating first with Mary Ann and then Jeanette. Alternatively, Dee and Sandy, or Reed and Sandy, if you have a question you want asked, they have cards, you can fill them out, and they will give them to our media people, and they will ask those questions. You all will get a 1-minute introduction. You will get 1.5 minutes per question. You all have 2 red cards. At any time you want to use that for an additional minute, just wave the red card. I will be keeping track. They are not, I'm a former soccer ref. These are not red cards the way I know them. I think first we're going with Bill Hoagland. There you go. Thank you, Leah.
Good evening. My name is Bill Hoagland, and I'm delighted to be running for a position as one of the trustees of St. John Health's Board of Trustees. I'm sorry I can't be there in person tonight, but I have a long-standing commitment with a company in Seattle, of which I am the chair. My business background is in finance, management science degree from Duke University, and then an MBA from the University of Chicago. I worked for JP Morgan in investment banking for 18 years before leaving for Seattle to work for one of my clients as his CFO. Lanny and I have lived in Jackson for almost 20 years full-time. Since we moved here, in addition to being very involved philanthropically, I've been active on the boards of some of the most vital and necessary organizations in town. I served on the board of the Community Foundation for 11 years and as its chair for 2 years. I also was a founding member of the board of Teton County Search and Rescue, served on its board, and also was its chair for 2 years. In addition, I've been on the boards of Teton Literacy Center and Teton County Fire EMS Foundation. I believe that St. John's Health is one of the critical, essential organizations to ensure our community's longevity and vitality. I believe that one of our board's responsibilities is to support the hospital's management team, to help them accomplish their goals, but not to second guess or micromanage their operations. From my limited exposure to date, I believe that Jeff Sauls, the current CEO, is an outstanding CEO. A community like Jackson cannot survive without an excellent, independent hospital. While I'm not a medical professional, I believe my expertise in finance, my deep knowledge of the community, my demonstrated success in advancing local organizations' missions through excellent governance will contribute to the success of the hospital board. Thank you very much.
And then I believe Susan is going to read the statement from Mr. DeBoer.
Good evening. Having moved to Jackson 3 years ago, after retiring from practicing cardiology for over 32 years, I have found a move that has been even better than my expectations. I love this community, and increasingly feel that I am an integral member of it. My motivations to run for hospital board are the same motivations that I had while practicing cardiology. Those motivations are to be, 1, an advocate for patients, and to afford them the best possible medical care. Patients deserve both excellent quality of care and excellent service. My experience while in practice included both private practice and managed care provider network systems. Each system has its own set of strengths and challenges with respect to meeting patient care needs and the systems and resources to meet those needs. Patient-centered care should always be at the forefront of medical decision-making. St. John's Health developed a strategic plan based on community input to provide excellent medical care and services. The optimal goal would be to provide all care and services locally. In rural community hospitals, there are challenges to provide broad and comprehensive quality medical care in all areas of medicine at the local level. Often, those challenges involve providing complete specialty and subspecialty services. A balance exists between which services can be reasonably supplied locally and which need to be outsourced. There will always be services that will need to be outsourced. It is more difficult to maintain quality of care and level of service when the care is no longer local. What becomes most important in having very strong relationships with outsourcing practice partners, which will give them a sense of commitment to provide excellent quality medical care and a high level of service to our patients. My role as St. John's Hospital trustee is to represent the constituents of Teton County and do my best to meet and hopefully exceed their needs and expectations from medical care through St. John's Hospital. Thank you. Mark DeBoer, MD.
Thank you, Susan. You did that quite well. Let me see if I can manage this without looking. Maybe not. I think I can do it. No, I'll get the balls. Thank you. The one thing I forgot to mention, Karen Durger is our timekeeper. You all don't care that much. You all do. She will show you when you have 30 seconds left, and then alternatively, when you have no time left. I will be relatively strict. I'll let you finish your sentence or thought, but rambling is not encouraged. We will start down at the end in alphabetical order and then rotate. So if Shannon will get the first question, then Jim's first response will be the second, and so forth. And Mary Ann will bring the first question.
First we have intros.
I beg your pardon?
1 minute intro.
Oh, yeah, of course. But before we get to the first question, he's a candidate, and actually we'll start with Shannon, and then Jim will get the first actual question with a 1 minute introduction. So Shannon, you can go first.
Okay, I'm Shannon Brennan. I am president of my own company that does management consulting for the federal government, especially in the energy sector.
Thank you. Shannon Brennan. I have my own company, Shannon Brennan Associates. We do management consulting for the federal government in the energy sector. I've been here 40 years. I have recently moved up to Moran, and I wanted to stay active in the community as well as continue to work. I started in the world of hospitals in high school when I worked for a nun-run hospital, and later found that I wanted to get a master's in hospital administration. Beyond that, I worked for the Wyoming Health Systems Agency looking at proposed uses of federal funds. And now I would like to turn all of my 40 plus years in federal energy management, those skills in project management, risk management, financial management, contract management, to leadership and oversight on the board. This would really, really be a commitment to wrapping up my career. Stop.
Thank you, Andy and the league. Andy's an inspiration for public service. I'm Jim Hunt. Quick bio points. We've had a house here 25 years, full-time the last 10. Community involvement, I was on the START board, 9 years at the Jackson Hole History Museum, including 3 years as president when we launched the new building, raised the capital, and completed it on time, on budget. Also, I've been on Friends of Pathways the past 6 years. I grew up in El Paso, Texas, worked in construction while I attended UTEP, got a degree in economics there, went on a year after that to Wharton where I got my MBA. And then I started my career in investment and finance, putting out over $40 billion to investments at that time. Became a senior credit officer at Citibank, was at Sun America running investments, founded 2 PE firms, private equity firms. So I have a lot of time hiring, supervising, dealing with CEOs and boards. St. John's Health, I think it's working really well now. Isn't my first rodeo in the boardroom, having served on numerous public and private boards. I'm currently engaged as non-executive chair of an affordable housing company, one of the largest in the US, and I'm the real estate guy in the boardroom.
Thanks, Jim. Good evening, everyone. Thank you to the League of Women Voters. I'm Evan Jones. I'm the current trustee of St. John's Health, and my wife Cindy and I have lived in the Valley for 5 years. My background is building successful healthcare companies. I was a public company CEO for 20 years, and I served as vice chair of the Board of Trustees for a $1 billion revenue children's hospital in Washington, D.C. As a trustee for St. John's Health, I have made a difference for our hospital and the community. As co-chair of the CEO Search Committee, I helped recruit our new CEO, Jeff Solis. As chair of the Strategy Committee, I led the St. John's Successful Strategic Planning Initiative. As a member of the Finance Committee with Jim Hunt, I've helped successfully address employee housing with the King and Carnes and Hitching Post projects, and we've significantly improved employee morale and expanded hospital services. I've served as a financial expert for public companies and helped raise capital, which is something that I think is important for St. John's in the future. And I'm a hardworking trustee with a proven track record. I bring a depth of experience and commitment to making St. John's the best it can be. And every day I work to earn your vote. Thank you.
Thanks, Andy, and thanks, Karen. Thanks, everybody. I'm Bruce Hayes. I've been a family physician here for over 40 years. My initial involvement with the hospital board was in 2008 when Emmy Knobloch, former physician here, bless her soul, she was a wonderful person, but she and I decided to run for the hospital board because we could see what was happening with the hospital, which was really not entering the 21st century. We were tired of our patients as soon as they had any serious diagnoses, they felt like they had to go somewhere else. And so we felt that we needed to get this hospital moved into the 21st century. And I've been on the hospital board then since 2008. And I think we've seen tremendous improvement in the hospital in that time. The hospital now has received numerous awards and is generally recognized as one of the superior small hospitals in the country, which is a complete turnaround from when I got on the hospital board in 2008, which is not all to my doing. It's basically been a communal effort. We've had very good hospital boards, very proficient, good people to work with, and I appreciate the privilege of working for the community. Thank you.
Thank you. I forgot to introduce our media people. We have Jeanette Boner from the Jackson Hole News and Guide and Marianne Zumberg from Buckrail. And by a complicated process, Marianne will get to ask the first question, and Jim Hunt will be the first respondee. So we're ready to go.
Thank you so much. Why is this an elected role as opposed to an internally appointed role?
That's statutorily determined. And, you know, it's a challenge, I think, for the electorate to determine what puts together the best set of skills for the hospital's achievement. And diverse skills, diverse opinions that can work collaboratively creates the best dynamic in the boardroom. But it is an elected position, and we hope that we come together as an effective team.
Yes, Mr. Jones, you're next.
Sure. So I think Jim touched on a lot of this. The hospital is a district hospital, which is quite unusual in the United States. Most hospitals are either for-profit or not-for-profits, which still need to make a profit for their bond ratings and things. But so the people of Jackson County own the hospital as a freestanding entity. And so they have to have a voice in helping pick trustees. We have been using revenue from the county to help support the operations of the hospital, which is another really important factor of why people need a voice to help choose the leadership and the direction of the hospital.
Well, the reason that this is an elected position is because we need people to care about the community to serve on the board. And that's really the first thing. We have lots of people in this community that are very proficient, very talented people in all kinds of areas. But what we need for this position is not only individuals that are very competent, but also care deeply about this community, which I certainly do. This community means everything to me. And the people here, being able to serve the people here, that really has to be the primary focus of what we're doing on the hospital board, and that's why it's important to have it as an elected position, one where we're responsive to the individuals in the community.
Pass the mic down.
The reason that these positions are elected and not nominated or appointed is because this is a hospital district. Not all hospitals in the state of Wyoming are hospital districts, but this is unique in that it is statutorily based. But there are a lot of resources that are used to run this hospital. It's not simply a board of folks who can offer opinions and advice and go home at night. The hospital is 24/7. There's a lot of money that it takes to run it, whether it comes from grants or taxes, third-party reimbursers, whatever it might be. So in order to ensure that there's, number one, representation, but at the same time, number two, what would you say, qualified representation. This gives all the people who are supported by the hospital the chance to vet that. These people on the board have to be very carefully screened for the ability to actually oversee the hospital. And please note, I believe this hospital, as a public hospital, needs to be very transparent, and we need to ensure that we have adequate financial, project management, program management, people management, stakeholder management resources. The only way to get that is to reach out to the public and then let the public vet that. I guess there's a stop.
That's right.
Thank you all. So Jeanette will get the next question, and Evan, you will answer first.
In fact, it's me, Miriam, with Buckrail once more with a follow-up question. Sorry to throw a wrench into the order. How are you preparing for a possible elected position, or in the case of incumbent board members, how are you preparing for a potential new term? Please tell us how you familiarized yourself with the state of St. John's Health.
Well, thank you. I've, as I mentioned before, served as a trustee for the last 2 years. It's been a great experience. Actually, I've learned a lot about both the Valley and the hospital. But I feel that in helping both bring on board our new CEO and work with the other board members and the management of the hospital to develop the strategic plan, we have a clear vision of where to go with the hospital, to improve quality and operational excellence, to build on our existing workforce, to build housing, and to expand care in various different areas. As an example, we're working to build out oncology services, expanding in orthopedics. They're working to expand women's health care. So there are a number of initiatives that are going on at the hospital that I feel like I'm up to speed on and ready to make an impact, supporting management, as that's our critical role as a trustee. Is this the right direction?
Yes. Well, I'm going to be involved with the hospital regardless of whether I'm elected or not. I think I've calculated that I've made probably over 10,000 visits to the hospital in my years here. And so I'm going to be involved with the hospital regardless of whether I'm elected or not. But in terms of where things are at right now, as was mentioned, we have an excellent CEO right now, Jeff Solis. I've seen over 20 CEOs come and go, and Jeff is, I think, the best one I've seen. But that being said, all kinds of possibilities can occur. There's all kinds of changes that can happen fairly rapidly, and you have to be prepared for any sorts of eventualities, including changes in government policies that may affect our reimbursement, changes in personnel at the hospital, people resigning, so on. So I think it's the main thing. I feel we need to be flexible and be able to respond quickly to any changes in the hospital environment such that would threaten our stability and independence.
If I am elected, I would immediately get in touch with the CEO and the board to understand what they have learned in the past from their mistakes and understand what their hopes and dreams are for the hospital. I'd also find a way to understand better the expectations and the perceptions of the employees. I would also go out to the community and find ways to understand what the expectations and needs are in a very on-the-ground way. I would review the documents that exist, recent correspondence, policies and procedures that have been reviewed or approved or both by the board. I would look into the approaches to issues that have been taken in the recent past and try to be a part of it and help to look at possible ways to improve additionally. I would also ask questions about the future because I'm very, very concerned about how we are planning this hospital to go into the future. I understand Dr. Hayes' comment about bringing it into the 21st century. How are we going to make it through the 21st century? So I would ask a lot of questions about that. But above all, I would be talking to people and trying to draw out their perspectives and listen to them. I would be very aware of compliance and about cash flow and about balance and about the perceptions to ensure liquidity in the near future.
Yeah. Thanks. It's a great question. I've been a trustee for the last 18 months and an advisor to the Finance Committee for a year prior to that. And so I'm so deeply in the middle of what our projects are now. Specifically, workforce housing has been a very consuming project. And what's terrific about my outside professional engagement, I come into the boardroom with best practices and ideas that are hopefully accretive to the hospital. So I feel I'm equipped to chop wood during the month and at a monthly meeting. So it's an ongoing engagement.
Thank you. So unless I'm overruled, Jeanette will ask the next question, and Bruce will be the first respondent.
Hi, Dr. Hayes. According to, can you hear me? No, I just want to. Hello? I think my 8-year-old could have helped me with that. According to St. John's strategic planners last year, 42% of Americans between the ages of 18 and 44 would trust Amazon, Apple, or Google to manage their medical care, while 19% trust their local hospital or healthcare system. As a board member, what does that mean to the future of St. John's?
What was the last part of, what was the last phrase there?
19%.
Yeah, the last phrase though.
What does that mean for the future of St. John's?
Oh,
When looking out at the...
yeah, and I think that's a very good question, and that's part of why we're no longer St. John's Hospital. We're St. John's Medical Care, St. John's Healthcare, St. John's Health, because we're trying to provide a more broad spectrum approach to healthcare in this community, which has included things like our wellness program, a lot of outreach, a lot of preventative systems that we're trying to put in place that I think are really important for this community, and a lot of outreach. And this stuff is very important, and it isn't bottom line stuff necessarily. For instance, we've had the diabetes educator position in the past, which the CEO said, well, that's not making us any money. We need to get rid of the diabetes educators. And we said, no, you're not getting rid of the diabetes educators. They may not make any money, but they are so critical to the health care, particularly of many of the Hispanic diabetics that don't have adequate access. And I think that I could get into this a lot more. I think we need to do a lot more with the Hispanic community. I think that's one area where we are seriously deficient. We've tried to work hard on developing better systems for health care for those people. And in general, we're trying to make it clear to people that we're not just a hospital, that we are a source of wellness and health care for the community.
If you could pass the mic down, please.
I agree with that 40% that doesn't trust healthcare, except for, what was it, would trust only Google and Amazon and such. Because they may not have had experience with the healthcare system, they may not have been able to afford it, they may not have had a good experience with it. But that doesn't mean that St. John's automatically is not meeting the needs of those people. I think that there's been a lot of good that's happened in this community as outlined by some of these other candidates. I also think there's a lot of room to grow, but we have to remember that if you've got that kind of statistic out there, we better be ready to listen and to understand what is it that you want when you go into urgent care. You are underinsured. What is it when you go to the hospital with some kind of an emergent situation and you're not clear about what doctor's telling you what? We have a wonderful opportunity in this community, because it's small, to talk amongst ourselves and to come together in small groups to tell folks from the hospital, or maybe talk with the board members to say, you know, I'm not happy about my insurance reimbursement. I got a Medicare Advantage and now I'm paying more than I ever have, and I'm getting older and sicker. So I think that there's this great opportunity to reach out and listen to the stakeholders instead of being concerned solely about what we have to offer and what we can do in the future. Let's look from the outside in, because if we don't have those people in the outside coming in, we don't need a hospital. Let's listen to them.
Yeah, that's a fascinating statistic that I don't think is representative of our community. You know, in Los Angeles, you can order on Amazon and get it in 2 or 4 hours. Not so much here. So I don't think those stats are reflective of our community. But the question being asked, and I think St. John's works hard to understand the community, survey the community. We've done a great job surveying staff of late to understand, are we meeting the needs of our community? But I don't think, it doesn't feel to me, as a big user of St. John's Healthcare, that I would rather use Amazon or Google.
I agree with Jim. There's a lot of headlines about this topic, and Amazon, their model is to buy primary health clinics so they can push their drug delivery model. They're not really addressing the needs of people in a rural community hospital setting like St. John's Health. We've got to operate great outpatient clinics and a great hospital. And one of the focuses at the board level in this planning effort that we had is to keep care local, so that first you have high quality care. If it's outpatient, you can deal with one of the urgent clinics. If you need to be hospitalized, to get as much as possible. But then if you have a longer care, more chronic situation, that you don't have to go to Salt Lake for your care or to Idaho Falls, that you can get as much care as possible here in Jackson Hole at the highest level. And that's why we're doing things like expanding the oncology program with more infusion capabilities, more diagnostic capabilities, and making this a much stronger hospital. And Amazon's not going to do that, right? You don't have to think too hard to realize that. And I would add that St. John's has a great record with, and we can always improve. But when you look at the surveys that get done, which are part of our credentialing and operating the hospital, we routinely rank in the 95th percentile nationally. So I think the hospital is doing a nice job trying to address these disruptive forces. At the end.
That is the end. The next question, I think, will come from Mary Ann, and Shannon, you will answer first.
Thank you. This is a question from the audience. Thank you for submitting questions. If you have more, please keep them coming. In 2024, CEO Jeff Solis, supported by the board, terminated the health fair blood draws that many in the community utilized, and many healthcare providers not employed by St. John's no longer have discounted access. Do you have thoughts about this type of community services?
I'm going to have to ask for a clarification. That first part didn't seem to match the second part. Does that count in my timing? Thank you.
Sure, I'll read it again.
And the rest of you benefit from it, yes?
In 2024, CEO Jeff Solis, supported by the board, terminated the health fair blood draws that many in the community utilized, and many healthcare providers not employed by St. John's no longer have discounted access to. Do you have thoughts about this type of community service? Is that cleared up?
Yes. In this kind of a community, a small community that is changing so quickly, it is really hard to tell what the community expects or needs. But I did recognize that there was quite an outcry about that. And we all come to this issue with different expectations. I don't think that this particular issue, it was well understood what was driving the withdrawal of it. And so this to me is an example of an opportunity to be more transparent with the public about what things are happening and why, and then to listen. And if there was pushback, was it discovered internally? Did Jeff Solis discuss this with his team? Did he discuss it with the board? And what impact did it have with the community? I think more information is needed on this one, but if I had to take a side, I would say it's always good to opt to ensure that the expectations of the public are met, and that if there was this need, it should have been sustained. I will cede my 30 seconds to whomever.
That was a popular service. I don't think it was heavily vetted at the board level, and I think it should be open to reconsideration. And I'd like to know the metrics, the costs, the community participation, but I think it's a worthwhile topic to re-engage with.
I think this is a great example of how to look at governance in an institution like St. John's. This was brought to the board sometime earlier in '24, and myself and another trustee were specifically opposed to eliminating these health fairs. In my case, it was based on personal experience building a cervical cancer screening company, one of the leaders in the world, and learning that, for instance, in women's health, for years people were told, oh, women shouldn't be able to have pregnancy tests or different tests because they can't handle the results. And that was some of the thinking that led to dropping these health fairs, was that if people got screened in a health fair, they wouldn't have follow-up. But as a trustee, you can't always micromanage that situation. You can try to evolve it, and I continue to be supportive of things like health fairs. But it was vetted and discussed by the hospital leadership and medical staff. They have very good reasons for why they stopped that fair, which had to do with the inability to follow up with those patients. And they didn't feel they were giving the level of care that was consistent with St. John's to patients that would be in those healthcare fairs. But just to finish, my own bias would be do more outreach, do more testing for people, and listen to when the community says this is important, try to figure out how to do it.
Thanks. Yeah, I was totally opposed to this decision, and I think it was very poorly, came about very poorly. It was basically pushed by members of the medical staff who felt that individuals may not be getting adequate follow-up. Instead of looking at ways in which they could obtain better follow-up, they simply decided to eliminate the program, which that was something that affected only the people in the lower socioeconomic strata of this community. I don't feel that that's fair to those people who don't have insurance. The cost of screening blood work is well over $500 these days. These people can't afford it. All my Hispanic patients essentially are uninsured. They can't afford this type of expense, and this is what they depended upon to have their screening blood work. And so I think we have to be very careful in our decisions that we don't affect the individuals who are on the lower economic scales in this community. And the only thing that has kept me from coming back and fighting this decision was the fact that Wyoming Healthcare did move into the community, and Wyoming Healthcare is actually fulfilling that that responsibility to provide that kind of blood testing now. So as such, I think it's become a moot issue at this point.
I'm going to take this opportunity, yeah, you can pass it to Jim, to remind the candidates that you have red cards, and you can get extra time on any question when you would like to speak longer than the allocated time. Having said that, I believe, I already forgot his question, Jeanette, and the first respondent will be Jim.
Hello. We have plenty of questions, but appreciate the audience weighing in. And this is another question from the audience. Where do you see St. John's being in the next 10 years with regard to services that are provided?
Doing what we do presently as well as possible. We are one of 400 five-star hospitals out of 5,000 in the nation, but keeping that level of excellence first on those services. We are in the planning stages of expanding radiation oncology to complement medical oncology. We have terrific surgeon doing oncology work, as well as having successfully recruited a medical oncologist. So there will be incremental growth in services, but I think the trustees should be mindful of what is sustainable in a rural community such as ours. As I mentioned, I've been very engaged in workforce housing, understanding the needs of the staff, And housing for physicians is every bit as challenging as it is for nurses and other members of the staff. So I think being mindful of what we can accomplish in terms of, one, the metrics of the community and what is sustainable from the base of our population.
I have a very optimistic view about the future for St. John's. I think there are a lot of challenges, but, and some of these views come from my experience in a large children's hospital that had satellite clinics, a lot of high-end care programs, and then trying to translate that to our situation at St. John's. And when you look over the next 5 years, we have a lot of capital investment that we're going to have to make. Our primary care unit, which is a bedrock of the hospital, needs to be rebuilt. This is a major initiative. Our outpatient clinics, I don't know how old they are, but the experts say they've got to be rebuilt. You could go through $100 million of capital investment that needs to go into the hospital for us to stay at the top of what we can be. What's exciting for me is I think we can do that. We have been working to raise money through philanthropy. The hospital's finances are improving under Jeff Solis' leadership. And so there's a lot of promise, and we need to draw patients from around not just Jackson Hole, but the greater catchment, from Pinedale, from there are challenges bringing them over from Victor because of reimbursement, but other places in Wyoming. And that will support expanding services. An example, there's been a request to do kidney dialysis in the valley. I hope none of us have the need for kidney dialysis, but if you did, you'd want to get that service here. The more patients we can bring, the more of these specialty services we can bring. An example where we're doing that really well is in oncology. And I'll put my card up. That too. I think the hospital can also really build and strengthen our programs in orthopedics. And so if you looked at St. John's years from now, we'd have great surgical care, strong orthopedics, great outpatient clinics, and doing everything we do even better than we do today.
Thanks. I think Evan did a good job of describing what we need to do in the future. And there's lots of services that we can add and that we do plan to add in the future. We're actively looking at recruiting specialists such as neurology, working on gastroenterology. We need rheumatology. We need all these services. We could use a dialysis center. We could use radiation oncology. We could use a cath lab. There's all these things that we could use. What we have to really keep in mind is what the community needs. And I think it goes back to Lou Hoheiser, who was one of our good past CEOs, and he would always sit in the meetings and say, well, now remember, we're not here to make money. That's not our goal. Our goal is to serve the community and provide benefit for this community. And so we always have to look and see, is this what we need to do for the community? Is this what we're doing simply to make money? That's not our goal. Our goal is to provide for the well-being of the people in this community, and that's the thing we need. And so there's always these lots of different medical services that we could provide that we really have to look at, okay, what does the community need, and are these feasible in view of our bottom line, which is tough in this community, particularly with the housing costs, the cost for employees, and people aren't aware, but we used to have relatively low costs. We had costs that were lower than the average hospital in Wyoming. People aren't aware of that. We don't anymore simply because of the cost of living in Jackson. We can't do that, but we will try to expand whatever we need for the health of this community.
Oh, I apologize.
That's okay.
He was very subtle.
Very subtle. And I was oblivious.
Okay. Are you okay, Bruce?
I'm
If you
fine.
need more
Okay, Shannon.
time, I'd be happy to do that.
I think that St. John's needs to be talking, the hospital board, the hospital management, the employees, members of the community need to be talking about their vision for the next 3 years. That's a near-term horizon, 5 years, 10 years, and 20 years. Because there hasn't been a community in a long time in this region that's grown so fast and so to such a diverse way that it's very hard to predict what we're going to be faced with for medical and healthcare needs, even in the near term. Yes, people are quietly getting on planes and flying elsewhere to get their healthcare. We know that. People are quietly getting in their cars and sneaking off to Star Valley or Ermac, or it sounds like maybe Lander or Pinedale. Is this what we want? We need to identify that. We need to have conversations. We need to put it down in writing. We need to have a vision of what kind of specialties we want. Do we need a lot of kidney dialysis? Possibly. Do we need cardiac cath intervention? Probably. On and on. But we need to open this up into the sunshine and actually start thinking it through. We need to obviously think about doctor, nurse, technologist recruitment and housing, that has to come after we identify what we're going to do. Otherwise, we have no basis for saying that we need to have X amount of workforce housing. We, yes, do need to meet the current needs, and it is severe, and I'm totally in support of that. But I absolutely think we need to put down in writing what it is that we want, how many units, how many beds, how many patients do we want to serve. And we want to be able to, right now, line up the funding, because a lot of this is capital, and we're going to have commitments, we're going to have buy-in. But here's the real question. Where is the space going to come from? If we're limited to 4 stories for buildings, and right now St. John's is basically landlocked, with plans being approved by our county to build around it. So somebody somewhere needs to be talking with St. John's. Perhaps it's the city council, perhaps it's county commissioners, perhaps it's folks who are doing all their long-range planning, and talk to us about what their basis for their planning is. And that comes down to how many people are going to be in Teton County in 2 more years. Some of us have been here for 40 years. Yeah, thanks. Well, I thought I saw 30 seconds.
Oh, did I?
I thought.
You know, I am not a good moderator.
I'll cut it off here. I just wanted to say that I think that now is really the time to be looking into the future and not be afraid of it, and not be afraid to take the risk of saying, we're going to have 10,000 more people, 14, 20 more, and actually start making commitments based against this. And that's what I would like to bring to the board.
And my apologies. I believe that's that, and so Mary Ann, it's your question. Evan, you will be the first respondent.
All right, thanks. Often a patient's first touch with the St. John's Health System is through the clinics. What role do the clinics play in the larger picture of healthcare in the Valley?
The clinics are essential to providing access for St. John's. But just before we go there, I just wanted to come back and comment on Shannon's, what she was describing. It's a pretty grim picture and outlook in terms of planning that's gone on for St. John's. And in the strategic plan, all the questions that you've asked have been addressed. And the leadership under Jeff Salas have outlined the work to be done that's going to build sustainability, and they have a 10-year facilities master plan that the board is working to fund and articulate. But back to the question about primary care, we'll have a presentation on Thursday at the board meeting for the hospital about building and investing in primary care. It's an essential gateway to the hospital. And Jeff Salas and his team, and Lindsay Love, who's in charge of that, doing a really great job to improve from where we were several years ago, to make the access more quickly. How long does it take for you to get a clinic visit? Do you need to have gone to the ER? They're doing things like expanding services in Teton Village. They've expanded the hours to provide access for all of us to the weekends. So there's a lot of great work going on with the focus on this outpatient care. And then if you take a little broader view of it, you realize that the outpatient clinics include access to specialties. And there, you know, in women's health, for instance, there are not enough providers there. So the hospital is working collaboratively with the OBGYN clinics in the Valley to expand access to gynecologic care. So a lot of good work, but it all begins with this focus of the primary care being the gateway for the hospital.
Yeah, I think the clinic system is one that really pretty much didn't exist when I first came here, and has developed somewhat haphazardly through the years without a real cohesive focus. And that's one thing that we are doing at this time, is trying to develop a more cohesive approach to these clinics, which are very useful and necessary in this community, and they're an example of a service that's not necessarily lucrative. It doesn't necessarily make money for the hospital, but it's essential for people to have access to quality health care, and by having the hospital running these clinics, we're able to ensure that we have high quality health care and that people are able to access clinics on a fairly urgent basis. Developing the urgent care system here was very helpful for people. They don't have to, if you get a bloody nose, you don't have to go to the emergency room and run up a $1,000 bill anymore. So the whole clinic system, that's a very good question, because it is definitely essential to the hospital's functioning, and one that we haven't really had a good handle on in the past, and I think we need to have a better handle on how we're developing these clinics. But we are doing that, and that is a focus of Jeff Solis's.
I would like to follow up on Evan's comment. If there's a long-range plan, I'd like to have access to it. I'm sure that it's probably built on pretty solid data with a lot of people who are knowledgeable putting it together, but it's important to look at it in terms of the bigger picture of the growth of this community, and that's my concern. And if I'm wrong, I will back off, but I do maintain that. Now we'll move into the urgent care question. I do maintain that everything we do to plan and put money into healthcare in this area has to be integrated with the bigger picture. But what about the traffic getting over here? How many people have difficulty getting over here today because of the traffic? What about the urgent cares? Are they located in the right place? I know they're haphazard, but thank heaven we have them. I think they've served an excellent purpose. I'm very thankful that we have one up in the north end of the valley. I can't speak to the integration of all of them together because I don't have that inside management experience, but I think that that may be a cornerstone to healthcare delivery, medical delivery here in the valley, and I think it is the future of St. John's, is to really strengthen the urgent cares. But I do go back to, we have to look at the long-range planning in terms of how many people, where are they, what are their needs, and who's doing what in the county, with the commissioners, et cetera, leading the charge with things such as wastewater quality, with other things that impact health, transportation, all of it. Stop.
I do encourage folks to go to the St. John's Health website, which does have the strategic plan. I can't remember if the demographic work done by our consultant is on the website. It probably is, given the open meeting requirements, but a considerable amount of thought was given to the future of our community and what the demand on St. John's would be. Well, you know, I want to find out more about the question on the health clinics recruitment. We've gotten a couple of really talented primary care physicians recruited to the community, thanks to Jeff and his team's work. But I have jealous part-time friends here who they might be 2 or 3 months out in getting an appointment here, where I've been successful getting great health care, you know, within 2 or 3 or 4 days. So I think we have a terrific situation here in our community.
You did start.
That was the first one.
Yes, you were the first one.
I can keep going with the
Jeanette
demographics.
gets the next question, and Bruce will be the first respondent. And I commend you guys in cooperating.
Thank you. This is another question from the audience. Expanding life-sustaining services is wonderful, but I've had 3 primary providers leave in the last 8 years. How can that be
The
resolved?
library is closing in 5 minutes. Thank you.
The library is closing in 5 minutes. I think it speaks to employee retention.
So in light of the interruptions, Bruce, did you get the question?
The question was basically how do we prevent the turnover of primary care physicians.
Yes.
Yeah, that's something that we have throughout the hospital, not just in terms of primary care physicians, but in terms of the staff in general. And as you know, Jackson is a very tough place to live, to survive, regardless of whether you're a physician or a server in a restaurant. And we're going to have that kind of turnover. We are making significant efforts to provide support for anybody we hire here in terms of housing, in terms of any kinds of amenities that we can to keep these people here, because this turnover is a significant problem. And I think that actually we're doing much better since Jeff has arrived, and we have significantly fewer vacancies in our employees. In terms of physicians are no different than any other employee as far as their turnover and their difficulty of living in Jackson. And you know, we're always going to have that problem, but we are seriously working on addressing it and doing the best we can in this community. Goes down here.
This may be a disappointment to you, but I don't believe that there's anything else that really can be said. Dr. Hayes is in a position to see this, and I agree from what I have understood from my own position as a receiver of medical care and such. It's disconcerting to have your primary care physician leave that person's the eyes and ears of your total health aura. And so whatever can be done, I am fully in support of the actions of the board and the hospital administrator to do whatever it takes. I also think that we need to be prepared that this is life in Jackson, unfortunately, and maybe it will calm down. Maybe there will be some really good retention after a while when the diversity of our population normalizes, when the cost of living gets under control, and so on and so on. I don't see it happening in the future, and I'm very empathetic about it.
I do bring a fair amount of this back to housing, and it's acute across the spectrum of employees. We have 50 open positions presently at the hospital. When workforce housing is completed, and some of those units are appropriate for more senior medical professionals, that will help. But I don't in the near term see the economics of living in Jackson changing. And we may have a life here of people who are here for a period of time and move on. And it's, you know, I would hate to have that my primary care physician who's terrific turnover, but that may be a consequence of a very challenging rural high-end environment.
So a lot's been said. I'll just try to add some other thoughts and perspectives. First, if you lost, whoever asked the question, I'm sorry about that. And I can only say that as a trustee, we're working hard to address these kind of issues. For me, it's an example of where leadership really matters. When we recruited Jeff Salas as the new CEO, we had criteria that included being a people person, being able to recruit people and bring them into the system and have what I would call some happiness in the organization. And that's resulted in lower turnover than you had under prior administrations and during the pandemic, and some bringing in of terrific providers. Dr. Gallup, who's been joined in Wilson, for instance, my wife needed a primary care provider. She signed up with Dr. Gallup. One of the best doctors we've ever interacted with. Very encouraging. Yesterday in the Strategy and HR Committee meeting, which takes place generally in advance of board meetings, we saw a presentation of 5 new providers that were brought in and are in the process of being brought in this year. So a lot of progress. There's one other subtle change that Jeff Salas has tapped into, which none of us would have expected. It turns out people want to leave high-cost other states. And we're recruiting people from California who want to come live in Jackson Hole. Some people think, okay, it's not great, we're getting an influx of people, but we're getting good doctors that want to come here and can afford to because they have lower taxes and their home costs just as much in California.
Thank you all for those interesting comments. The next question will come from Mary Ann, and Shannon, you will go first.
All right, thanks so much. Before I ask, about how many more questions do you think we'll have time for?
I'm going to defer to my bosses.
I'm going to say probably 3 or 4.
Great.
Right?
Fantastic, thank you. All right. Nationally, as well as locally, women's health care has made headlines. Would you advocate, or how have you advocated for women to have access to a full array of healthcare services?
I think it's criminal that women do not have access to very traditional types of services for women in this country. Unfortunately, throughout the world, this is a horrible situation, but it's inexcusable here. I'm a big advocate for women's issues, for the access to birth control, access to testing, and access to the counseling that's needed. And it's time to grow up, and we provide this. Oddly enough, it's also needed in Jackson. And I think that now is the time to look into this, fund it, recruit the necessary physicians and PAs, and actually measure the difference it makes. And there are ways to do that. This has been a silent issue, and I believe that we can absolutely address this with ease. It's just adding one more feature to our suite of offerings from St. John's Health, and we can show that we can do it well. There are things we're talking about adding, the cardiac cath, other capabilities. Why not women? Now is the time. Unfortunately, the people who are most at risk are the ones who are the most silent. So it's up to us to be considerate of this and to ensure that this sort of a suite of services is provided. I support it 100%. Has nothing to do with my gender.
I think this is a great question. I think it is out of the scope of the trustees. So for me, it's very political. In the questionnaire for the News and Guide, I responded that I'm strongly in favor of Medicaid expansion. We're picking up the tab. We're just not taking advantage of the 85% we receive from the federal government. Happy to take agricultural subsidies, but not Medicaid expansion, which would pay for maternity care, women's care in lower demographics. Secondly, I support, because again, I think this is political, all my wife is doing for maternity care across the state, which has been dubbed a maternity wasteland.
So this area of women's health is a high priority for the current Board of Trustees. You probably are aware of the difficulty in recruiting OBGYNs and women and people involved in that end of the women's health care business. And Jeff Salas and the St. John's leadership team have taken this on directly to try to solve it for our community. And they're doing it by hiring people that will work for the hospital. It's the difference in the past when there was a lot of supply of OBGYNs wanting to come work in places like Jackson Hole. They would work in private practice, and that's really dried up. So the leadership at St. John's is taking this on with the full support of the board to really beef up and strengthen everything from delivery to ongoing OBGYN care. They've had to take it into their own hands, really hire people that then are going to partner with the private practices. And I'll just add that for me, this is very close to the heart because, as I mentioned earlier this evening, the company that I built a premier women's health business. And I learned to understand that you've got medicine for men, and you've got medicine for women, and you've got medicine for little kids. And the kids and the women, we've really got to focus on helping make sure that everybody gets the same kind of care.
Yeah, I think part of the question relates to the fact that the hospital really doesn't have, has not had control of the women's health in this community in the past. There have been several OBGYN different groups here which were independent, private, and not under the auspices of the hospital. And unfortunately, that system is somewhat crumbling now. They've had significant difficulties with maintaining support for these private practitioners. The hospital is at this point stepping up to provide support for new providers, services, and I think that in the future we will see significant improvement in women's health care in this community. It's not going to be as fragmented. It's going to be more under the auspices of the hospital. It's going to be, I think, quality care. We have some very good possibilities in terms of what's going to be happening here in terms of women's clinic in the future. Yeah, this partly relates to understanding the medical system in this community. The last question about the provider turnover, and I can remember in the old days when the hospital did not have these clinics, and we had many physicians who came here for several years, 2-3 years, and that's gone up and left. So the fact that turnover is now 6 or 7 years may be an improvement now that the hospital is the authority over these clinics.
Great. Thank you. The next question will come from Jeanette, and I believe Jim will be the first respondent.
As an elected, you have a balance that you need to perform. There's the balance between addressing community needs and supporting the direction of the St. John's administration. What does that balance look like for you?
Well, trustees on boards in general responsible for hiring, compensating, or changing CEOs, and then engagement principally in strategy and finances. I'm sorry, can you repeat the question?
As an elected, you listen to the community as well as drive the direction of the administration. What does that balance look like?
Well, I see it as a fiduciary responsibility. One thing about being a trustee, or when I was an advisor, is you do get comments from the public. I do speak to Jeff Solis when there is, somebody's had a less than satisfying experience with the hospital, but it's first and foremost, trustees, I think, are engaged to provide St. John's permanence for the future. And I strongly believe in maintaining the independence of St. John's because of the breadth of services we provide the community, which would not be likely maintained by a private provider such as Intermountain Health.
I'd like to think that a lot's changed for St. John's in the last several years. Before I joined as a trustee, there was no real strategic plan for the hospital. We brought in a new CEO who's from one of the top healthcare systems in the country. He knows how to run hospitals. He's a professional hospital operator. One of the first things he did as he joined was work with myself and others. I chair the strategic planning committee to develop the strategic plan for the hospital. Well, the reason this is critical to this question is in that planning process, we did significant outreach to the community. We ran sessions where people were invited. We advertised in the paper. We got feedback from everybody across the community. So I believe the hospital is aligned with the community and its needs to the best it can be in terms of operating a fiscally responsible business. So it's exciting in that way. Of course, we still got to listen very carefully. And I'm sure there's more we could do to establish formal mechanisms of getting feedback. from the community. But in terms of the big investments, we've gotten a lot of that feedback. You know, we heard that people wanted to be able to get their care more locally. Well, there are very exciting investments going on in the oncology area, which get back to demographics. What we learned in the work was the population of Jackson Hole is predicted to stay relatively flat. It's not going to explode. There's no place for people to live. What's changing is people are getting older. There are fewer younger people and more elderly people with the gray hairs, unfortunately. So that's built into the plan, and that's listening to the community.
Well, I'd like to say, in the first place, one of the things we do is have these patient questionnaires, and just 2 days ago we had our monthly meeting going over these, evaluating these questionnaires, people's rating of this hospital and their comments on their care, and we do listen to that. We listen very seriously, and that's the difference between this hospital and a chain hospital, where you have the community that you know, we take this personal responsibility to care for all of you and to listen to you and to find out how you're being treated, because it's so important that people feel that they have a place they can come and be listened to, where their voice counts, where they receive compassionate, caring health care. And so we do have mechanisms for getting lots of feedback. I get lots of feedback anyway, and I'm always getting feedback on issues like, okay, well, you guys are paying your CEO way too much. You know, that's just ridiculous. Well, you try to explain to them that, hey, we very carefully evaluate the pay. We compare it to comparable hospitals. We have to make that kind of decision. We do it very responsibly because we're spending the community's money. And what we do is so important for the future of this community. And the hospital is also the largest full-time employer in this community, so it's a huge economic engine for this community. So we have lots of responsibility there. We have to listen to the community.
Pass the mic down, please, Bruce. Mike. Thank you.
I'll read a little bit into this question. I'm seeing where the thought might be, what is that balance between the board, the hospital, and the community? The role of the board is to oversee the management of the hospital. Jeff Saul, the CEO, is to manage the hospital. So the board is to review and oversee and ensure compliance. And it's also to listen to the community. And I know that there are mechanisms there, and I think they're very powerful mechanisms. The interviews, the questionnaires, the 10-year long-range plan that is out on the web. I'm talking about something though much more dynamic than that, and that is a relationship that is vibrant and dynamic and real time. So what goes on in the community, you might think you know what it is, but I would suggest some caution, because the people who aren't coming to the hospital, aren't coming to the urgent cares, those are the target people. Those are the ones that we need to find out, what is it that they expect, what is it that they want, what is it they need. And that makes for a really vibrant community and regional hospital here. I also don't want to see the large chain hospitals come into the community. This is our chance to be all as one team, listening to the needs of the community and planning for the future. And I mean a dynamic ear listening all the time for not 10 years, but 20.
Do you think you're up, weren't you? Evan went first.
I was first.
I am just not paying attention. Okay, so
your red card.
yeah, if I have to go sit down. Okay, so Evan will get this question. That's actually what I have written down here. And I think Mary Ann is the questioner.
Yes, thank you. What does transparency look like as a member of the hospital board?
Terrific question. I think it's a challenging question because everyone would like to have perfect transparency in everything that gets worked on in a board out in the public. That's probably not completely realistic when you think about driving things forward and having them ready to be evaluated by the public. So the committee structure at St. John's tries to, balance this by having debate about issues, but when they're ready to come to the board, and that everything that the board does be fully transparent in the community. All the documents, everything, unless it's protected for employee reasons, for example, or it's a negotiation of a sensitive contract, those sort of things you'd understand in any organization. But otherwise, there's really a commitment to full transparency. And in the last several years, we've made a lot of progress doing things like, for instance, publishing the agendas for the board meetings with the times when topics are going to be discussed, so people can come and listen. What surprises me is very little attendance for these board meetings. You have a lot of hospital staff, but not these kind of numbers, unless there's a really hot issue. But fortunately, things are going well for the hospital, and maybe that's partially because of this commitment to transparency that's been really with our current chair and co-chair, Dr. Cutler, in the back, to this transparency issue.
Yeah, I think in the past, I have seen times when the hospital board and the hospital administration, I would say more so, has been less than transparent. I think that we've made significant strides in recent years to develop more transparency, understand the responsibility of the hospital to keep all of our business as open to the public as is possible without compromising things like patient records and employee evaluations, that type of thing. We've had some significant legal challenges to the hospital board over the last few years in terms of questioning our transparency, and I think that was probably good that we had that, because it did force us to look at what we were doing, and basically looking at what we were doing, we didn't find any major problems with our transparency. We have had some minor changes to the ways that we do things, which I think are very good, and I think this legal action has been very useful. I would have to say that in the years I've been on the hospital board, it's been one of the more above board, honest, direct systems that I've been on a number of boards, and these boards have been remarkably good, community-minded, open individuals, including Evan and Jim. Thank you.
The role of transparency in a public hospital is a big one. This is not a private hospital. If it was private and the board of directors was a corporate board, they could have a lot more private sessions and get things done more efficiently. So there is a price to pay for being public, and the transparency is that price, and the time it takes to be transparent and the extra effort. I ran for this canvas. I was a candidate for the hospital board 2 years ago, and that was one of the big reasons that I wanted to run, was the transparency. I felt that there was a lot more work that needed to be done. And thanks to Evan and Jim and others, and Bruce on the board and others, I will just say, whether this is really compelling for you to vote for me or not, I will say I've seen tremendous progress made in the transparency, and I'm really proud of it. Fact is that earlier there was this comment about trust from the 40-somethings. Transparency is going to equal trust. This is one way that we can get ahead of it. So I really, really support the efforts of this hospital and the board particularly in turning around a culture that in most places would be impossible to do in the time frame that it took.
I do think as a committee we're fortunate to have the News and Guide, Buck Crail, because they are great conveyors of information. Somebody who doesn't necessarily read those oftentimes doesn't know what's going on in the community, and I think the hospital is doing a better job providing information to those news outlets, and consequently that is disseminating information that's valuable to all of us. I do get a kick out of looking at who are the outside participants in the monthly board meetings, and I get a chuckle out of critics of the hospital not dialing in and participating in the meeting or asking their question at the end of the meeting. And I did have one friend who was going to write an article here who said, XYZ isn't transparent. Well, have you ever dialed into the board meeting? And have you gone to the website where, the strategic plan and so forth is? So I think there's unappreciated transparency, but it's certainly a commitment.
Great. We're moving right along. The next question will come from Jeanette, and Bruce, you will be the first respondent.
Typically, this is how I will wrap up an interview, in asking, what am I not asking? What should I be addressing? What do you want to talk about with the time that we have left?
I think really the overarching question concerning the hospital is how we go about remaining independent and a community hospital that cares for ourselves, because it does scare me. It scared me for a long time at this hospital. If we make mistakes, then we could easily end up being taken over by one of the chain hospitals, basically being run by private equity funds out of New York, who do not care about the care for citizens in Teton County. And I think that's really the overarching question is how to go about in the long term maintaining this independent, providing services, remaining financially viable. How do you bring all that into a balance and making people understand that this hospital is here for them, and it is so important to support this hospital and to provide a place that basically is the heart of the community, where people are cared for and can feel like they are receiving care from a system that really cares about them.
I'm really thinking that the biggest challenge, the thing to be concerned about here, is how to navigate the future, as unstable as it is, with the economy, with world politics, with the challenges to affording these brand new technologies for healthcare that are wonderful, but extremely expensive. My concern is the internal blood, guts, and gore, pardon the pun, of the hospital. Because to run a hospital where costs are escalating so quickly, and third-party patient reimbursements are being challenged, and insurance companies pushing back, Medicare being very conservative, and the needs of the people shifting so quickly, like the dynamics of our older population here in Teton County. How can Jeff Salas, how can any CEO keep that balance and keep quality and the kind of performance, the kind of regulatory compliance that we seem to have here? We've enjoyed a really strong hospital, and I don't want to turn our back on the fact that it's been a really hard job to do. The threat of a large corporation taking over St. John's is real. At any step, if the cash flow becomes very pinched, if capital funds dwindle and we can't grow like we need to grow, there is a real threat looming that another company could come in and take over. Or there could be a consortium of hospitals elsewhere in the region who very strongly persuade St. John's to go big. I'm concerned about the internals.
I think it's a great question. I think there are three legs to the stool that makes St. John's work. Extraordinary staff. My experience has been above and beyond. Second is philanthropy. There was a graffiti recently on a building. We can't depend on philanthropy. I think we need to celebrate that we have those people in our community. And then the third is the mill levy, which right now is $1 or $2 million above the otherwise operating loss of the hospital, which provides all these services. So I think as you drill into risks and ask questions about what are the risks, those three, maintaining a happy staff at the hospital, having an offering. I don't think I could live here without St. John's being what it is. And then, so all the philanthropic support that engenders, and then the political support for the mill levy that we have today.
I agree with Jim, you and Bruce's comments about, and Shannon, about the financial stability of the hospital being a topic that's merits a lot of focus and attention. As Jim mentioned, we operate with about a 4% loss from the core operations. That's providing extra services to the community. That's made up for by about $12 million of tax revenue. So if the tax revenues continue, that's great, but if they were to shrink, we would have a difficult time. So there's an effort to try to continue to improve and strengthen the profitability of the hospital while maintaining the services. The other challenge we have as the population gets older, a lot of us, even if we might not want it, are basically operating in the Medicare system. Reimbursement for Medicare patients is less. Even though we can afford to pay, we can't because we're capped into the Medicare system. So that's putting a lot of pressure on the hospital operations. We have rising costs and decreasing reimbursement because of the Medicare situation. So it's challenging. I think to be successful, and I'm very optimistic, we're going to need to be good at philanthropy and helping build these big capital projects that are coming down the road. And with Anna Olson at the foundation, there's a lot of good work going on there. And it's an exciting time, and I would like to continue to help build the hospital in the coming years as we're able to both balance these financial needs and build an even better St. John's.
Great, so I think that is the end of the question period. We will now go to the closing statements, and Shannon, you got to give the first opening, and now you get to give the first closing.
Which means I'm the toughest one of the bunch, yes?
I'm not going to comment.
Okay, so much for impromptu stuff. Why vote for me? I'm formally trained. I have an MA in Public Administration, Hospital and Healthcare Administration. I spent 8 months in a medium-sized acute care hospital doing an internship in hospital administration. And that included moving a hospital from one campus to another and transitioning the employees, the hardware, the nuts and bolts, and the patients. And that was a really big experience for me. I was a Wyoming Health Systems Review Associate, reviewing all proposed federal funds for use of federal funds for any capital projects in any hospital in the state. So I have knowledge of the healthcare facilities in the state. I then was derailed to go into energy management, and I have a lot of experience in project management. I'm certified by Stanford as an advanced project manager. I have received designation as a senior fellow with the Partnership for Public Service in Washington, D.C., and so on and so on. I have demonstrated leadership and management skills leading large-scale $6 billion to $10 billion projects. I can't tell you anymore because I've got stopped, and I am a compliant person.
Although I will remind you, you all have a red card available.
May I commence? I am an experienced consumer, let's put it that way. It's nice to be able to say that I know the insides of a hospital from a patient perspective in a certain way. I have been a patient several times at St. John's, and I've had absolutely the best experience. I value that very much. Stanford, University of California, San Francisco, Mayo, Monument Health, Sanford in South Dakota as well. This place is top notch. I would like to be a part of it. I would like to help lead it. I have a really good sense of the role of the board member, the role of the board member, and I have a great sense of respect for the leadership in the hospital, not just Jeff Salas, but his entire management team. And I feel as if I could, while being a wee bit of a lightning rod here, I could bring energy, innovation, a new way of thinking to the board and help them to continue on with the good work that has been started in the past few years. I'd really like to support this, so I'm really asking for your vote. Thank you.
I think it's hard for the community to go wrong with this bunch. So, so it's, as I described earlier, I've been engaged in the hospital for the last 3 years versus an advisor, which is a process more typical of a corporate board where you're interviewed for your specific skill you're going to bring to the table. So in my case, it was real estate, finance expertise. So as the community moves forward with this group plus the other two who aren't here, I think thinking about how you constitute the right team to work with the management is important for the community. So I hope I end up on your list, but the hospital is a great place and will continue.
Thank you. So you heard from a number of trustees and candidates tonight. I'll suggest that leadership matters. Just as our new CEO, Jeff Salas, has strengthened St. John's, my leadership and successes with St. John's have made a difference. My wife Cindy and I made Jackson our permanent home here 5 years ago, after building a successful healthcare career in building companies. In 2021, I read about the challenges facing St. John's. These were following the pandemic and the loss of a CEO. After decades of experience as a healthcare CEO and hospital trustee, I felt I could help the hospital. As a trustee, I've made an impact and the hospital is prospering again. After chairing the successful search committee for our new CEO, the hospital lacked a strategic plan for the future. As chair of the strategy committee, I led the board team that worked with Jeff Salas to develop the new strategic plan. Housing and employee satisfaction are significant issues for St. John's. As a member of the finance committee, which Jim Hunt chairs, we have completed or have in development more than 80 affordable housing units. It's a big accomplishment. We've significantly increased salaries for hospital employees and morale has improved. There's much more work to be done to build and protect our special hospital. I ask for your vote to continue to help build St. John's Health for the future. Thank you.
I'd like to say a couple of things. One is that a number of years ago, when a number of members of the community were trying to have the hospital sold or turned over to privatized, one of their reasons was that they didn't think that we had high enough caliber individuals to serve on the hospital board and run this kind of hospital. So I think that you can, as you can see, they've been proven wrong with the caliber of these candidates we have here. The second thing I'd like to say is that this year I did stop doing inpatient work at the hospital, taking care of patients at the hospital due to demands on my time. And the one thing that I really missed from doing that was the fact that previously I was going to the hospital every day, and it was such an edifying experience to be there in that community, providing high quality, caring, compassionate care. Was such a positive start to my day to go down there in the morning and have that kind of experience, because it's such a quality environment. And if I'm elected, I will do everything I can to maintain that kind of environment. Thank you.
Well, thank you all. I think we should give the candidates a big hand. I wish you all the best of luck. I would also like to thank our media representative, Jeanette. You are also doing a wonderful job. Once again, thank the League of Women Voters and the library for providing the opportunity and the space. And also to thank the audience. You all have just coming here to hear this. It shows your interest in the hospital and the community. I'm going to take this moment, the privilege of the moderator, to make one little comment myself. Having been involved in public service in this community for 30 years, it was alluded to by the candidates, the hospital does not operate in a vacuum. So remember, the town of Jackson, Teton County, what they do has an impact on the hospital. More importantly, what happens in Cheyenne can have a huge impact on the health service that we get here. Please remember that and pay attention to what the legislature does, because speaking from experience, it makes a big difference. Other than that, once again, thanks to Sam for doing the video work on this. Tell your friends, it will be available, I believe, on the library's website. And the last two more reminders. There is an election coming related to this. The election will occur on November 5th. You can vote now or anytime at the courthouse, anytime from now till November 5th. Also, there are other elections on the ballot. There will be a forum on October 9th for the Teton County Commissioners and the SEPT ballot, and October 10th for the Teton County School District Board. And my other reminder is, for those of you who are willing, they need help moving the chairs back to the sides of the room in stacks no higher than 4. Thank you all for coming and look forward to seeing you.